Hello, my name is Dr. Dewan S. Raja. Today I will discuss about lead poisoning. Lead is a soft, malleable metal, atomic number 82, atomic mass 207.20. It is one of the oldest occupational diseases of the world. It was known to the Greek scientist before the birth of Christ. It was known to US President Benjamin Franklin, who was who was a scientist, politician, and also who has printing and publishing company. He used to know about the dangers of lead poisoning. Sources of lead containing paint. Fortunately, in the United States, this is not the case because the paint does not contain lead for many years. Gasoline, also we are blessed in the United States. Our gas is lead free in most cases, but it is present in the pottery, jewelry, and toys, especially imported toys, jewelry, and pottery. Recycling plants, lead acid batteries, smelting and refining ores, pipe, metal alloys, solders, ammunition, even the imported food may contain lead. Imported spice may contain lead. So this is a banner of Environmental Protection Agency. So we are getting the sources of lead, drinking water, lead-based paint, job and hobbies, people working in the battery industry or in recycling industry, people repair the radiators of the motor vehicle, old toys, lead glazed pottery or porcelain, folk remedies in Mexico, in Dominican Republic, in India, and many other countries, lead smelter, and certainly drinking water is a source of lead poisoning. Okay, so everything should be checked. So drinking water, it should not contain more than acceptable level of lead that may lead to toxicity or poisoning. Okay, so folk medicine, Mexican Ajarcon and Greta, Dominican Republic, Liturgirio, and some Indian Ayurvedic preparations. What are the pharmacokinetics of the lead? Lead is absorbed through the respiratory system, gastrointestinal tract, especially the inorganic lead. Inorganic lead does not nicely absorb through the skin, but organic lead is well absorbed through the skin. After absorption, lead is distributed via the erythrocyte or red blood cell to multiple tissue. Lead can cross the placental and blood-brain barrier. So by going through the placental barrier, it will affect the fetus or embryo, may lead to intrauterine fetal death, or may cause congenital birth defect because it can cross the placental barrier. It may cause brain damage to both the fetus as well as in the adult because it can cross the blood-brain barrier. About 70% of lead excreted through the urine. Most of the lead burden occurs in the skeleton. So lead may be deposited in the skeleton years after year. Its clearance half-life in the soft tissue is 1 to 2 months and years to decade, maybe 20 years in the bone. Okay, so we are getting some of the sign symptoms in the adult brain, as because we discussed, it can cross the blood-brain barrier. We'll have memory loss, lack of concentration, headache, irritability, depression, and certainly personality loss or disturbed personality. Digestive system constipation may even cause pain in the abdomen, nausea, poor appetite, nervous system damage, including numbness and pain in the extremities. There may be foot drop, there may be wrist drop because of the damage to the peripheral nerve supplying the muscles. Body fatigue, joint muscle pain, cardiovascular high blood pressure, kidney abnormal function and damage, reproductive system and decreased sex drive, lack of libido, and sperm count, maybe oligospermia, azoospermia, and sperm abnormality, sperm without tail, sperm with two head, like that. In women, there may be spontaneous abortion or miscarriage. In children, decreased bone and muscle growth, nervous system damage, blood, there will be anemia. Anemia may present also in adult. Behavioral problem, lower IQ, hearing loss, learning disabilities. And we discussed that lead can be deposited in the bone for many, many years. Here, just above the epiphyseal line in the metaphysis, this is the deposition of lead on the lower part of the femur. In the upper part of the tibia, here is the fibula, upper part. Okay. So mechanism of lead poisoning, it inhibits enzyme activity, interfering with the action of calcium, iron, and zinc. So the poor children has more chance to get lead poisoning because their diet is lacking calcium, iron, and zinc. And the poor children may expose to old painting, altering the structure of the cell membrane and receptor. That is one of the mechanism of lead poisoning. What are the adverse effects of lead on blood? Anemia, it may be normocytic, cell size may be normal, may be microcytic, may be less than 7.2 micron, hypochromic, less hemoglobin in the RBC, inhibition of heme synthesis, increased RBC means erythrocyte or red blood cell membrane fragility. So membrane will be fragile, so there will be hemolysis, breakdown of the RBC, toxic injury to the bone marrow with release of nucleated RBC. Our RBC has no nucleus, but in case of lead poisoning, bone marrow is damaged, so there will be release of nucleated RBC and RBCs with basophilic stippling. Okay, so this is the blood smear. We are getting basophilic stippling here. Okay, this is a nucleated RBC. RBC should not have nucleus, but here we are getting nucleated RBC, and we are also getting basophilic stippling here. Here, these dots. We'll get a blue line along the lower part of the gingiva here, like this. This is a sign of lead poisoning. We might have drop, the wrist drop, because the nerve has demyelinated, specifically the posterior interosseous nerve. Foot drop, person cannot dorsiflex. Okay, so there is demyelination of the deep fibular or deep peroneal nerve, so there will be foot drop, there will be wrist drop. These are the telltale sign of lead poisoning in the old person or adult person. Okay, treatment of lead poisoning, treatment, termination of exposure, and supportive care, good nutrition, calcium, iron, zinc-rich food. Chelation therapy, chelating substances will remove the heavy metal from our body, will remove the lead from our body. For severe cases, EDTA, this is a chelating agent. EDTA stands for ethylene diamine tetraacetate, or dimercaprol, also called BAL. BAL stands for British Anti-Leucistic. For less severe cases, penicillamine like couprimen or dipen. And that's all about the lead poisoning. To remember that lead poisoning is more common in children because their system help them to absorb it very quickly. So a lot of them play with the paint or chips of lead. That is also another cause. And the poor children has more chance to get lead poisoning. So that's all about the lead poisoning. Please share the information with your friends. If you have any question, please feel free to ask me. And I have a book, Toxicology Digest. If you are interested, you may collect it from Amazon. It is present both in paper copy as well as electronic copy. So last of all, I am asking for your kind support to my channel. Please subscribe me and have a nice day. Bye now.